Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents and happy holidays to everybody. Please remember that these videos are not intended to replace visits to your physician. If you think your child is sick, we're happy to see you in our office on the same day. We're here till 6 o'clock most days. Give us a call at area code 775-359-7111. Please don't call and ask us to treat you over the phone or over the internet. Ethical medical care dictates that I only treat patients that I'm actually caring for, which means I need to see you to provide care. Today what we want to talk about is group A strep or strep throat. What is it? How do you get it? How do you distinguish it from other things? Group A strep is a bacterial infection in the throat. It's very common. It's also commonly misdiagnosed. And ironically, not something that we really per se need to treat. What am I talking about? Because we all know that you give antibiotics for group A strep. Well, let's start with what is it? Group A strep is a very common bacterial infection. The bacteria live in your throat. Many times 1 out of 10 people carry the bacteria. It lives there all the time, causing no particular problems. Something goes awry and all of a sudden it becomes invasive, many times in and around the area of the tonsils. And exactly what that something is that's gone wrong, nobody understands. Once it happens once, it can keep happening. You can get small abscesses in the tonsils that then reseed and result in frequent reinfection, and that's a reason to take the tonsils out. As far as symptoms, the most common symptoms of strep throat are fever and sore throat. Specifically, strep throat does not cause runny nose. Strep throat does not cause cough. If you have a lot of cough, if you have a lot of runny nose as dominant features of your illness, chances are this is not group A strep throat. Let me say that one more time. If predominating symptoms are runny nose or cough, this is most likely not group A strep. How do you know for sure? It's hard to know for sure. You really need to do a culture or a rapid test in the office, but there's a good chance that that's not what's going on. Certain viruses can mimic this, and in fact, big red ugly tonsils with a lot of pus on them, the biggest, reddest, ugliest, and most covered with pus, are actually most commonly infected with Epstein-Barr virus, not group A strep, further clouding the diagnosis. The reality is you have to do some sort of a test to rule in or rule out strep. And the rapid tests that we use now, the third generation rapid tests here in 2011, are pretty good with a roughly 99% sensitivity and specificity, giving you a positive predictive value of roughly 99 to 100% and a negative predictive value of 98 to 100%. Or you can do a culture. The one thing a doctor cannot accurately do, and this has been shown time and time again in the literature, is look in the throat and tell that it's strep. If your doctor looks in there, says, yep, this is classic strep, then he's classically wrong. There's one exception, and that's something called uveitis, which is a very unusual type of strep infection affecting not the tonsils, but the little thingy that hangs down in the back of your throat, and uveitis is almost always group A strep. But if you don't have uveitis, you can't look in and tell. Why do we treat it? Because I said earlier, we don't treat it to cure the disease. Group A strep throat, realistically, gets better all by itself. If the tonsils are huge, they can cause obstruction and sleep apnea, and we may need to take them out, but we don't use antibiotics to cure that. So what are the antibiotics for? Well, the antibiotics are because in rare cases with group A strep, if left untreated, the immune system can go haywire and not only attack the strep, but start to attack other body parts. In particular, the kidneys and the heart valves. And the heart valvular disease is known as rheumatic fever, and rheumatic fever has the potential to be fatal. So we're treating to prevent rheumatic fever, not to cure what's going on in your throat. Rheumatic fever is not going to be a problem with an acute infection until you've been infected for a minimum of 7 to 10 days. So on day 1 of that sore throat, when you run in to see your doctor and he says, let's do a culture, you have plenty of time to wait for that result before anything bad happens. What's the harm in treating, you say? Well, lots of harm. You can certainly culture for antibiotic resistance, but hey, who cares about society at large? I'm interested in me, right? Well, antibiotics have a lot of side effects, and we have videos, or I've done videos that talk about antibiotic side effects, but briefly, they can cause a lot of diarrhea. They can cause something called Clostridium difficile enterocolitis, which has a 25% fatality rate. It can cause something called Stevens-Johnson syndrome, which similarly has a 20 to 25% fatality rate. And when mixed with Epstein-Barr virus that causes mono and often mimics strep throat, results in a very unpleasant head-to-toe rash that can be extremely itchy and hot and burning and miserable. And that happens if you use amoxicillin, ampicillin, penicillin almost universally in cases of Epstein-Barr virus. And it's miserable. It has to be treated with 10-day courses of steroids. That can be prevented by making sure you have the right disease. And we make sure you have the right disease with very cheap, very fast throat swab. So I hope this has helped you to understand a little bit about the disease, why we treat the disease, and what the symptoms are. Remember, it's mostly fever and sore throat, not a whole lot else. You can have some swelling in your neck, the area a lot of people refer to as the glands of the neck. In reality, they're not glands, they're something known as lymph nodes. And you can read my video or watch my video on lymph nodes to get a little bit better understanding of what lymph nodes are and what they do. But that's it for symptoms. Cough, runny nose, vomiting, diarrhea. Very rare with strep throat. Vomiting in little kids sometimes, 2-3-year-olds. The other thing that's important to realize is it's usually, as far as who does it happen to, it's usually school-age children. Adults don't get strep all that often, and little bitty children under 3 and 4 years old only get it rarely, for reasons not well understood. Something else to consider before you come in and see your doctor. I hope this has been enlightening. Happy holidays to all of you. This is Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine. We'll see you next time.